like to welcome everyone back to SIM 21, day 2 of our annual meeting. I'd like to give a particular special welcome to our first time annual meeting guests, whether you're part of the SIM Global Track attendees or you're just someone new to SIM checking us out. We're glad you're here. I think you'll find us loose, fun, and driven toward making improved health, really improving health across the world through imaging informatics. You'll find SIM to be a community of diverse and innovative imaging informatics expert professionals leading the research and application of discoveries in whatever space we live in. I hope you'll find this meeting to be the beginning of a long time learning with us. I'd also like to thank the folks who helped bring this meeting to us. This is a long time coming every single year. And we are very grateful for all of your help. Cheryl Kreider-Carey, the Chief Executive Officer of SIM, Andrea Saris, the Deputy Director for Events and Corporate Relations, Nikki Medina, the Director of Education and Content Development, Anna Zawacki, the Senior Manager for Programs and Corporate Relations, but also really heavy into the sciences side of SIM, Bradley Davis, the Manager of Education and Online Learning, Megan Olek, Director for Membership and Operations, Missy Thompson, Manager for Membership Services, Priyanka Harlel, Director of Marketing and Communications, Bill Crawford for SIM's web presence, and Mackenzie Mercer, Intern for Education and Content alongside Nikki and Bradley. This meeting takes a long time to get ready for, and SIM 20 ended the 26th of June last year. We had our first debrief meeting less than a week later, and we started planning in earnest with the entire program committee in September. And this actually was a late start for us. Usually we get started sometime in August or late July. So for all of you who've put in many months of work making this happen, to finally have the beginning of SIM yesterday, a very successful day, we, all of us who are attending, say thank you for helping us. I'd also ask you guys to consider going to take a look at the product showcases and the products that are out there that can help you deliver better care for your patients, better working alongside your colleagues. Go talk to the industry sponsors. As I mentioned yesterday, today is intended to be heavy on collaboration between providers and imaging informatics professionals and our industry. It's a great time to catch up with your vendors after a really challenging year, to relearn where they are with their product development roadmap. And the online access that we have, the virtual program, really allows you uninhibited ability to educate yourself to the product offerings in an unintimidating way. So especially if you're a first timer, or maybe you're not the ultimate decision maker yet, you can fill out your knowledge so that as your career grows, you have the background that you need for how technology has developed. Today's going to be, again, heavy on Ask Industry sessions, Industry Connect sessions, and Tech Chat sessions. We look forward to all the engagement that we're going to have. A few things to remember. The SIM membership meeting and awards ceremony is 8 hours from now, Eastern time, that is 6 p.m. in the United States. First thing in the morning, if you really need to decompress and stretch out after all the terrific education that you got yesterday, and you're going to need some time to move a little bit, SIM has a virtual yoga session that's going to kick off day 3. Don't forget to post your SIM 21 fun run on Twitter and social media. And don't forget to claim your CME. We talked about this yesterday. Go into the left-hand navigation menu of GRIP, go under session surveys, and take the surveys that you find there. Again, you'll get 1 credit for each eligible time block. With that, I'm going to turn it over to Dr. Khan Siddiqui, someone familiar to all of us here at SIM, to introduce our keynote speaker, Dr. Jonathan Rothberg, today.
Thank you, Chris. It's great to be back at SIM. It is my great pleasure to introduce our amazing keynote speaker for today, Dr. Jonathan Rothberg. Dr. Rothberg is a scientist and entrepreneur who I have had the pleasure to know for the past 2 years. One of the quotes of Dr. Rothberg that has inspired me is that he likes to solve problems that will save lives of somebody he loves or somebody we all love, and at the same time create a social impact. That mission and that vision has led to tremendous innovations that he has created, and you will see from his talk and amazing things he's done. He was awarded the National Medal of Technology and Innovation, the nation's highest award for technological achievements, by President Obama, for inventing and commercializing high-speed DNA sequencing, which has impacted so much in our COVID pandemic last year and continues to do. Dr. Rothberg is a founder of Fort Catalyzer Medical Technology Incubator, and the founder and chairman of all its companies. So Butterfly Networks, Hyperfine, Portable MR, Tesseract Health, Liminal Sciences, Detect, Quantum SI, and AI Therapeutics, and a lot more coming in the future. These companies all focus on using inflection points in medicine, such as deep learning, next generation sequencing, and the silicon supply chain to address global healthcare challenges, and are making a difference and creating the future. With one of his former companies, 454 Life Sciences, Dr. Rothberg brought to the market the first new way to sequence genomes. And with that technology, Dr. Rothberg sequenced the first individual human genome. Prior to 454 Life Sciences, Dr. Rothberg founded and served as chairman and CEO of Curagen Corporation. His contribution to the field of genome sequencing included the first non-bacterial cloning method and the first massively parallel DNA sequencing method, concepts that have formed the basis of all subsequent next generation sequencing technology that exists today. Dr. Rothberg is a Ernst & Young Entrepreneur of the Year, is a recipient of the Wall Street Journal's first gold medal for innovation, South by Southwest Best in Show, Nature Method's first Method of the Year award, and numerous other awards. He's a member of the National Academy of Engineering, the Connecticut Academy of Science and Engineering, is a trustee of Carnegie Mellon University, and an adjunct professor of genetics at Yale University. Dr. Rothberg received his PhD, MPhil, and MS in biology from Yale University, and his BS in chemical engineering from Carnegie Mellon University. Without further ado, Dr. Rothberg.
Thank you, Khan, and thanks for everybody participating today. I'm going to get right into my presentation. So good morning. Everything I do because of somebody I love. And today I wanted to take you on my personal journey and describe how my personal journey, which started with the birth of my daughter, has led to my interest in imaging and my interest in health and my interest in global health. So here's my story. My story does start with the birth of one of my children. In this case, you see my son Noah, and when he was born, he was brought to the newborn intensive care unit, and he was having difficulty breathing. And at that moment, I had thought that I was on top of the world. I had a beautiful child. I was the CEO of a public company that was worth $5 billion when $5 billion was a lot of money. And I had been studying the genome to understand what we had in common and to find points to intervene in major diseases such as cancer. But at that moment, with my son having difficulty breathing, I realized I was less interested in the human genome in terms of a map of all of us, and much more interested in a personal genome, my son's genome. What was the difference between his genome and other genomes that might account for his difficulty in his first day of life? At the time, there was a computer magazine in the waiting area, and it had a picture of a computer chip. And I had realized that most of the attempts to sequence genomes had been the wrong direction. They had been Henry Ford approaches. They had been assembly lines with large institutions working together to sequence the first draft of the human genome for either $3 billion in the public effort or the private effort led by Craig Venter, leveraging the public effort for $1 billion. And both of those were canonical assemblies, either of 50 individuals or 6 individuals. And what I wanted was an individual genome to know the difference between that canonical map and my son. And I did have 2 ideas that were based on the semiconductor industry: put everything on a single substrate and do everything in a massively parallel way. And at the time, I didn't know it, but it led to the birth of a new industry. Now, since then, DNA sequencing has entered the zeitgeist. It was fun to see it featured in my first machine from 454 sequencing viral genomes in Contagion, which is clearly applicable to the experience we've all had over the last 18 months, as well as seeing it in science fiction movies, decoding Jurassic Park dinosaur genomes. But that only mirrored what was happening in real life. We actually had sequenced the Neanderthal genome, and another group using the 454 machine had sequenced the woolly mammoth. And people had speculated maybe someday we would bring back the woolly mammoth or Neanderthal based on those genome sequencing. On the good side, physicians had decided that this was the biggest advance in 40 years. So it looked pretty good for the most part. As most of you know, DNA sequencing continues to play a major role in understanding outbreaks. The COVID-19 genome is 30,000 letters long. Our genome, for perspective, is 6 billion, 3 billion from your mom, 3 million from your dad. But by decoding those 30,000 bases over and over again in different populations or different individuals, you can track precisely the transmission of the virus. And as all of you are now benefiting, you can sequence the parts of the genome that are responsible for entry into your cells. We can take the part of that genome from the spike protein, make an mRNA molecule, inject it into your arm, and now you have a vaccine against COVID. And that vaccine was based on sequencing tens of thousands of viruses to make sure we put in a common sequence that would raise an antibody response against protein sequences conserved in the majority of the viruses. And even today, with the mutations that have come up around the world, the antibodies that are generated from this canonical sequence are still neutralizing. So DNA sequencing continues to play a major role in healthcare. Today, I'm not going to talk more about DNA sequencing, but I am going to talk about the lessons that I learned from my work in DNA sequencing, from my work in miniaturizing it, and specifically from my work in leveraging the semiconductor industry. So I always have good news and I have bad news. The good news is fast, inexpensive DNA sequencing, what we now call the $1,000 genome, has led to routine sequencing, precision medicine, and routine use in cancer and immunology. The bad news was I was a little ahead of my time. And at the same time that I was giving Jim Watson his first genome and the first individual genome, my board of directors decided that this DNA sequencing didn't have much of a future and they better sell the company. So I was fired. Now, I show this ego shot for those of you who have gone through tough times, because I can tell you getting fired was pretty brutal. You have your children, you want to take care of them. You have a company you want to nurture. You want your technology to help people globally. And you find yourself out of a job. But my postscript to getting fired is 10 years, pretty much to the month after I was fired, President Obama gave me a medal for the exact same thing I was fired for. Now, my lesson wasn't just to get fired. My lesson was what did we learn from DNA sequencing that we could apply to healthcare and more specifically to imaging? So I learned how to make low-cost devices. I learned how to leverage that supply chain to distribute devices that were at a cost that no one had seen before. I learned the importance of aggregating information, and I learned the importance of information, taking that sequence and getting actionable information from it, which are now, for example, used in routine cancer testing. I'll start with the semiconductor lesson. Quick history. All of you have experienced what happened when semiconductors were put in a chip. First, we had computing on a chip, and that allowed us to have multiple form factors, leading ultimately to our phones that we carry around today that have both a processor based on semiconductors as well as an imaging device. My work used semiconductors to, instead of compute or see light like a camera, to see chemistry, and that led to Ion Torrent and now Thermo Fisher. I'm going to talk today about using a semiconductor to change how we do ultrasound and using a semiconductor to create a new type of diagnostic, a diagnostic that's a hybrid between the branch of radiology and the laboratory chemistry branch. So first, a little bit about imaging. I know this is preaching to the choir, but it is pretty startling that 2/3 of the world has no access to medical imaging. And it's encouraging that 2/3 of the time, a medical dilemma can be solved by medical imaging. So that really drove me in my first company after DNA sequencing to see how we could use semiconductors to lower the cost of ultrasound. This slide really describes what we did. We put ultrasound on a chip. And what does that mean? It means we take the 20 years of technology that went into micro machines, and we combined it with the last 40 years of semiconductors, and we put them together. Often I'm asked why other people didn't do it before Butterfly. And there are actually two reasons for it. One is people were thinking about MEMS as if Henry Ford had seen a horse and carriage and decided his first project would be a robotic horse, where the real solution was the automobile. And in our case, it was that integration that was the real solution, not replacing the piezoelectric in a wand and connecting it with a long cable to a big box, but instead moving these micro machines and putting them directly on top of CMOS. Now, it wasn't easy. We spent over $250,000 doing it, but it was profound. And it was profound because for the first time, you not only had an imaging device on a semiconductor device, but you actually had a handheld device that could image the whole body. If you will, the world's first whole body handheld scanner. Because once you have those MEMS, 10,000 of them, little transducers on top of that CMOS, you can program them to any frequency you develop or any kind of pattern that you want to get the imaging you desire. And you can also mass produce them in the same foundries that make the imaging chips in your camera or the computing chips in your phone. So now we had a solution that would allow one probe to rule them all, a way to manufacture it at low cost. And what I want to point out, only the first of many form factors. What do I mean by that? Well, you saw a computing chip in a desktop, a portable, and now a phone. In the same way, we have first put our ultrasound on a chip on a probe, but we can easily put it on a patch, and ultimately we could swallow it and put it on a pill, just like a camera. So while the big idea is ultrasound on a chip, as all of you know, what really makes it convenient is the software that drives it. And it's that software that allows you to do anything you need to be done by pretty much anybody. Early on, I gave my son, Noah, he did recover, he was fine, one of the early ultrasound probes and some early software we did to show that we could use augmented reality to guide a user and AI to analyze the results. And my son was able to scan the hearts of all of his cousins using the augmented reality, guiding him through his phone, how to steer the probe. And then he was able to push a button and use the artificial intelligence built on deep learning to measure the ejection fraction of all of his cousins. Now, anybody around the world, you can go to websites in over 20 countries. We're working with over 100 NGOs. Anybody can get a probe, plug it into an Android or iPhone, pick some presets, and use it. And it only gets better. Just like your first camera that was digital got better every year, our chips get better and better leveraging Moore's law. In the left side of this screen, you see remote guidance. Somebody far away, can be 1,000 miles or more away, guiding a user by giving them directions on a screen. You see that we can do 3D imaging, and you see we can do color Doppler, because now we have a programmable device on a chip that under software control can do whatever you need it to do. We're actually doing biplane imaging now. Now, I'm not going to tell you that today the IQ Plus is better than a $250,000 card. I am going to tell you it's more convenient, and I am going to tell you we're just getting started, and I can tell you that there have been publications that say it is as good as a $50,000 card. And as I said, we're just starting. We're just starting to leverage Moore's law. And while most of you see this and see an image that's familiar, our vision at Butterfly is to go from the images I'm showing you today to a true window into the human body. 3D, real-time, colorized, with annotations, so anybody, anywhere in the world can diagnose themselves, someone they love, or someone they care for. We are just getting started. Now, I did start this company because of one of my children. Just like sequencing came because of my son, Butterfly initially was born because I was interested in understanding what was happening in the kidneys of my daughter. And I wanted something convenient and easy to use. But I think what I'm most proud of today is the fact that you can buy it online in 20 countries, that we are working with over 100 NGOs around the world to really bring equity to healthcare. And I was proud when the New York Times had us on the cover and called the work of the Butterfly team, and it is a team, the Butterfly team and the Butterfly family, hope in the palm of a hand. And I can tell you, while we're a public company now, and it's great to have a stock price, nothing is more rewarding than measuring success in the number of lives saved. And that really is reflected in how the Butterfly team came together during the early days of COVID. In January, one of my companies immediately sent Compounds, our AI therapeutic company, to Wuhan to see if they could help prevent the spread of the virus. The Butterfly team immediately sent probes around the world, including to Italy, where there was an early bad outbreak. And we literally had publications from Italy of people at home scanning themselves, looking at that COVID lung with remote help from a doctor. And so we went from a concept where my son could use pre-release software to guide the probe to look at the heart of his cousins, to real life people scanning their own lungs and helping people around the globe. Dr. Martin and others from Butterfly ran Zoom conferences with thousands of physicians, a number of whom actually diagnosed their own COVID lung. And we went from the standard of care being ionizing radiation and CAT scan to the convenience of ultrasound. And with 20 to 30,000 probes in the community, we were able to have a profound impact while hospitals were backed up, while people had to spend hours decontaminating the major carts. We could have our Butterfly iQ intense around the world, scanning people, at home, scanning people. Now, one of the things that happened during COVID is I would tell you that from March to mid-April, 15 years of change happened in medicine in 45 days. Many of you experienced this, and I'm just going to share our own experiences, whether it was a Canadian launch in 2 weeks, whether it was approval of Butterfly teleguidance. So now we could have a nurse practitioner in anybody's home, getting guidance from an expert from afar, or the launch of our educational sites to make sure more physicians understood how Butterfly could have a profound effect on their patients. And this changes forever. Healthcare is coming to the individual. AI is empowering the individual. The Butterfly iQ is spreading around the globe and will only get easier. And regulators over time will allow more and more people to be able to help themselves. Now, I am going to change gears because I don't want this to just be about Butterfly. I want this to be about thinking about what we care about most and making a difference in the lives of people, both in our community and globally. As you know, while ultrasound is an incredible modality for imaging, MRI is also super powerful. It's also super safe, but it has been only for the privileged few. Installations cost millions of dollars. Shutting off a machine in an emergency can cost $15,000. And so what I decided to do was get together the smartest people I knew, the best academics, like Matt Rosen, the best engineers, like Mike Poole, and ask them how they could change the world and how they could make a portable MRI. My first challenge was pretty simple. I said I wanted to be able to roll into any room, plug into a wall, and in real time, save somebody's life. And we put together a team, the Hyperfine team, and I can tell you today, they've pulled it off. We now have the world's first portable MRI. I remember when we went to our first conference and we scanned people on the floor of the conference, people in Twitter said it must be fake because you can't use an MRI machine in a crowded area with cell phones and electronics. But you can. You can when you have 100 patents and you've worked out how to noise cancel that interference. Our first investors were the Dolby family. They worked out how to noise cancel so you can put on headphones. We worked out how to noise cancel from the electromagnetic frequencies. Now, what's changed since that first MRI? What's changed is computing power. We have 10 million times more computing power per dollar now, so we leverage that. What's changed is green electronics. Your Tesla automobile, your wind farm. That's led to amazing advances in magnetics and the control of electric fields. And there's also changes in large-scale integration. Sure, I put things on chips. That's very large-scale integration in a small package. But you can also do that same large-scale integration in a bigger way. And that's what we've done to really transform imaging. Now, Hyperfine doesn't want to be the MRI or the portable MRI or the bedside MRI company. We really want to be the hub of digital surgery. We really want to be part of that care continuum, from an ambulance to the hospital to your recovery. And because of that, while our premier product and our first product is the world's first portable MRI, the world's first bedside MRI, we have built monitoring devices, and we have also started to work with robotics. And together, we think this will transform surgery. Here's just some quick imaging to show you what we can do. With a $50,000, roll into your room, plug it in, and watch in real time. Some of these scans can be done in 3 minutes. You can watch instruments, as I'll show you later, go in real time. But you can also add AI. And so if we want to help children around the world, which we are, with the Gates Foundation, we're deploying the first 20 of these machines, or we're deploying 20 of these machines globally into low resource settings. And in one case in Africa, we delivered a machine, it was unpacked, and we saved the life of a child within 4 hours without ever sending a person there, all done remotely. Now, just like Butterfly wants to be a 3D window into the human body, we don't want this to be just like any other MRI. We really do want to add that AI, whether it's to point out a ventricle or diagnose a bleed. But we do want this to be a real 3D window into the human body, augmented with that AI. Now, I mentioned the continuum of care. There is a shortage of not only people that can diagnose, hence the importance of AI, especially deep learning, but there is also a shortage of physicians. It's convenient for me in New Haven to be able to go to Yale University, where the chairman of neurosurgery, Murat Genel, is standing by to save the life of anybody that needs it. But that does not scale. That does not work globally. And so what we've been doing at Hyperfine is building out a robotic division to allow us to guide procedures in real time. In this image, I'm showing you from our Swoop MRI machine what it looks like in real time to put a needle into a target, missing the target, repositioning, and successfully going into the target, as you might do in a biopsy. Now, this is a future version, this is a future vision, but I do see a day where MR is used to guide procedures routinely, and many of those procedures will be done by robotics. Some will be done by humans, and some will be done augmented by AI. I do like to get back to COVID because it is important when you're in the middle of something, and we are still in the middle of something. While we've tamed COVID for the most part in New England and in the United States, the rest of the world is still dealing with it. And I am going to bring you back to last year when we were dealing with it in New Haven and New England. And the MR machines were backed up and people had neurological indications around, or neurological findings around COVID. And while we weren't FDA approved at the time, we did empty out our entire inventory, send them to local hospitals, and allow them to help patients. And that led to a number of publications. And I am excited to say that the FDA did give us full approval, not emergency use approval, full approval in 49 days. And we did end up launching the world's first portable MRI in 2020, 6 months early, instead of waiting for 2021 because of COVID. I am going to switch gears again. I've talked about Butterfly, which is the world leader now, the world's only handheld whole body scanner. And with its 500 patents, is really changing the world in terms of the use of ultrasound and the use of AI to simplify it. I did talk about portable MRI, and again, the informatics and the AI that enables it. And those are both things that are FDA approved. But I want to talk about something that we're working on now that I look forward to 2 years from now, sharing it with you as an approved device, saving lives around the globe. And that's a project we're working on to really reinvent and miniaturize how people look into the eye. This started in 1851, but the eye really is amazing. It is the only place where you can see veins, arteries, and the optic nerve. And it really is not only a window or a portal into the brain, but what we're learning is it's a portal into the rest of the body. And while this is fantastic that the retina is a universal diagnostic platform, I find myself in the same place I found myself 9 years ago when we were founding Butterfly and we wanted to put ultrasound on a chip to make it affordable, portable, and smart. Because there are fantastic machines for looking at your retina. In fact, there's a machine in Germany that can actually see chemistry through your eye. But again, analogous to what we saw with $250,000 ultrasounds, and why we put an ultrasound on a chip so we could have a $2,000 ultrasound. There is a $250,000 machine that can see chemistry in the eye, but it's a $250,000 machine. It's not FDA approved, and there's not enough of them to do the type of studies you need to correlate that chemistry to outcomes. So we put together a team and we developed a semiconductor chip that would see chemistry. And we took that $250,000 machine and all its functionality, optical coherence tomography, fundus, autofluorescence, and the ability to see chemistry through fluorescent lifetime imaging. And we're putting it into a $2,000 package. Again, analogous to that $250,000 ultrasound cart going into a $2,000 handheld probe. And again, to make it possible, we're moving things to a semiconductor chip so we can leverage Moore's law. And we're just starting. We've raised recently $90 million. We have a small team. And I hope to show you in 2 years, or better yet, I hope you to show me in 2 years how this is changing the life of people you love. So again, I've talked about ultrasound. I've talked about MRI. I've talked about imaging the eye. But what we all know, and we're all working on together, is that we must put this together. We must combine these modalities. We must do studies to make sure we understand, what does it mean if I have a lump in my thyroid by ultrasound? Well, if you have outcomes, you can retrain those algorithms and say, hey, was the elasticity that I saw on my Butterfly IQ around that bump in somebody's thyroid different? Does it correlate when they later sequenced that biopsy with a break in the BRAF gene? Because if it does, then that person should have that lump removed. And if it doesn't, they probably shouldn't worry. So closing that loop is what I like calling the long loop. And at each one of our companies, we're now doing the short loop with informatics. If a doctor looks at your heart and measures your ejection fraction with our software, he can correct it, and the Butterfly iQ software will be better at measuring ejection fraction. That's a short loop. If an expert looks at a child with hydrocephaly and corrects the Hyperfine software and fixes the size of that ventricle, the Hyperfine machine will be better next time. That's the short loop. But if we have outcomes, if we know what happened with that lump that we saw with the Butterfly iQ, or we know what happened to that child with that brain image, we can train it with deep learning, and we can really help people know when to take action. And we can combine these modalities. I mentioned ultrasound combining with sequencing results. But all of these combinations, especially with laboratory medicine results, are key. And all of us in this community have to continue to work together to make sure we can be interoperable. Now, I talk about Butterfly iQ and I talk about ultrasound on a chip, but the truth is we learned pretty fast that hospital systems like UPenn were adopting our system, not because it was a $2,000 device or an ultrasound on a chip, but because of the advances we had made in our enterprise software, the advances we had made in our cloud software, how easy it was to know where these probes were, how easy it was to aggregate information, and ultimately, how easy it will be tomorrow and the next year to fulfill this dream of this long loop where we bring information together to help people we love. Before I end and go to questions, I want to do a little promotion. Everything I've shown you is because of the people that I've worked with. I want to highlight my co-founder at Butterfly, Nevada Sanchez. When I started Butterfly, I went to Max Tegmark, a professor at MIT, and I told Max, this is a hard problem, and I'm not going to try to put an ultrasound on a chip unless he gives me the best student from MIT. And Max turned to me and said, that's easy. I was on the admission committee. I used to admit people just because I wanted them in my lab. Hope he doesn't get in trouble for this. And he admitted the smartest kids, brought them to his lab, and he introduced me to Nevada Sanchez. And it's Nevada and Carl and Jamie and the rest of the team that has put ultrasound on a chip. And at Hyperfine, it's Mike Poole, it's Khan, it's Chris, it's Mark Hughes, it's Laura, it's the team that have made it possible. And it's the same with Tesseract. So I need to thank the teams that made this possible. Over and over again, you can ask them. They'll tell you, Jonathan always gives us an impossible problem. And that's true. But it's only impossible until they get together and they make it not only possible, but they make it routine. And now it's routine to have ultrasound on a chip. And now it's becoming routine and will be routine to have a portable MRI. And at Tesseract, it will be routine to scan your own eyes someday and diagnose yourself. So I need to thank the team. I need to thank the advisors that have helped us, and people from Jim Watson to Gordon Moore to Charles Towns, who have inspired me and helped me in my mission. If you want to join us, follow me on Twitter, send me a DM, because it is the team, and it's the tenacious team. It's the team that comes into work at Butterfly every day because of their passion to save the life, to work with 100 NGOs. It's the team that goes to Hyperfine and says, guess what? We're going to operate in any environment, anywhere in the world. It's the team at Tesseract. So please join our teams. Help us bring health equity. Help us help people you love, so we'll have no regrets. When somebody we love needs something, it will be there. Thank you, and I'll turn it over to questions.
Thank you, Jonathan. Dr. Rothberg is always inspiring, and no matter how many times I hear these stories, they're always energizing and fulfilling. So as keep sending questions. You can use the Q&A section at the bottom, section at the bottom to ask any questions you have. Or if you want to use the chat, that's more than welcome to do that. I'm going to start with a question that I've had. I've seen you, Dr. Rothberg, really coming from what I call left field, right? As you said, everybody's building the Ford. Everybody's thinking of building a robotic horse, but it was the motor vehicle that changed the world, and you've done it multiple times. Where do you see the next challenge? Where do you see the next curve? Maybe even not within your group of teams, but where do you see the next breakthrough happening?
Wow, I love the question, and I'm not sure I can give it a full answer, because I had thought the next breakthrough would come from Microsoft and Google putting all of our health records on the phone. So when somebody used their Butterfly IQ to scan a thyroid and see a nodule, 2 months later, our AI would be updated because I would know the outcome, and I'd know if the BRAF gene was broken, and I'd be able to train the algorithm to say, well, a human only sees that image, the computer sees the elasticity information from that ultrasound, and I'd be able to close the loop and tell people who have cancerous nodules. And I've waited for the last 5 years for Microsoft or Google to make that happen, and I haven't seen it. So I really need a foundation to close the loop. We need that laboratory results. We need those outcomes. If you take a Butterfly IQ and look at a baby, and you're an expert, there's a 70% chance, or with a 70% confidence, you'll be able to say whether that baby has Down syndrome. If we could close the loop, we could make that 99%. So I need people to think about closing the loop, getting that information in a universal platform. So all of us that are making our MRI machines, our next Tesseract machine, or our next ultrasound on a chip, to close the loop.
That's great. You're absolutely agree with you on that idea of, it's been a vision for a long time for people to gather all this data to solve these problems. I have a question from an audience. Question is, any chance to make hearing aids more affordable to people? The technology seems to be there, but the cost is just not affordable for people.
Wow. I have to be careful because I just invested in a company to do that and to change it in a big way. I don't think they'll let me plug them yet because they're in stealth. Absolutely, that's such an important need. And it's not just about being affordable. It really is about being smart. If I can operate an MRI machine in a conference, you should be able to hear your mother-in-law. Well, never mind, bad example. You should be able to hear your child, in a background at an amusement park, trivially. Sorry to everybody's mother-in-law.
No, that was great. I think the thing that I wanted to ask another question was, I've seen one of the teams of your teams completely pivot what they're focusing on in this pandemic to solve the problem. You didn't talk anything about that. And I think that is, for me, that was extremely inspiring, and to see how you were able to get hundreds of people to volunteer within weeks. It went from 4 people to 120 people within weeks, jumping on trying to build a home-based COVID test. Can you talk about how that started and how that journey happened?
I can, and I appreciate the question. And so I told everybody in the beginning, I start my companies because of people I love. Well, for 20 years, I've had a pet project that I cannot justify around somebody I love. And it has to do with synthetic biology and using artificial intelligence and synthetic biology to make proteins for new drugs, to clean up the environment, to sequester carbon, to eat plastics. And I literally had started a company to do that, combining genetic engineering with artificial intelligence. We had actually rewritten AlphaFold to suggest how to do mutations. And I was so excited because I had wanted to do this for 20 years, and I had finally gotten a group together to do it. And then in March 7th, I'm looking at my home laboratory. Yes, I have a home laboratory. And I realize that I can't work on it. I called the team. Took me 2 days to come from the 7th to the 9th to get the nerve to call the team and said, stop applying artificial intelligence to engineer proteins to clean up the world's plastics in the ocean. We have to make a home diagnostic test. And we did. We made the first molecular test. It's 1,000 times more sensitive than an antigen test, and it's programmable. We did it for COVID, but in 2 weeks, we can make it for any pathogen. And it has literally protected my family since June. I've tested thousands of times. I've been living before the vaccine in a giant COVID bubble with 50 to 100 people that I've associated with. I've had many meetings. We just test everybody before we had a meeting. And so the team pivoted. Hugo Barra came in. Hugo had given the world Android, then Xiaomi phones and Oculus. He came in. He teased me. He said, Jonathan, you have a bunch of pirates. And he turned it into a real team. And now we have an amazing product. Go to detect.com, and we have a molecular test. We're working with the FDA, working with regulatory groups. The important thing is it's sensitive, it's accurate, it's rapid, and it's scalable. We can make it in unlimited quantities, and it's programmable. You could add flu, you could add anything. And it was amazing the team pivoted, but it is tough for me because for 20 years, I just wanted to evolve proteins and finally was going to get to do it. And I had to pivot the company because you do have to do what's right.
Yeah, there's one question from Dr. Ken Wang. He's asking, are there any lessons learned that you can share regarding diverse regulatory environments and moving technology across borders?
Oh, wow. The answer is yes. And one of the reasons I tell each one of my companies, whether it's Butterfly or Tesseract, or even a sequencing company, we have a new protein sequencing called Quantum-Si, which is starting to do protein sequencing, next generation protein sequencing. And we're bringing it public next month, so that's pretty excited. But what I tell my teams is from the start, think about putting your device in the home. And they go, what? You know, come on, look at Butterfly iQ, physicians use it. But I tell them that because if you can't use it in the home, you're not going to be able to use it anywhere in the world. And Khan, you can share your experience when you shipped the first machine to Africa, and within 4 hours, they were using it. So you have to think about that AI. You have to think about simplicity. And you have to think about the home is everywhere. There are 7 billion homes or 7 billion people in homes around the world. So you have to think about home. And if you think about home, then you can bring health equity to the world, whether it's your neighbor, your own neighborhood, or somewhere low resource anywhere in the world. So I think that's the most important lesson. Don't make something that needs a PhD to operate it, or you're not going to be able to help people globally. And, you know, my wife's a physician. She can go into the hospital and save a life. I can't. And the people that work for the team, you're a physician, you're lucky, Khan, but most of us aren't physicians. And the only way we can help people is by building technology that's simple enough to help people anywhere, anyhow. And then it is cool on Twitter having somebody mention that they saved the life of their dad.
Yeah, very powerful. The next question is kind of a long debate in radiology that's been happening. That radiology and AI communities, whether AI will replace radiologists or augment our abilities, and what are your feelings regarding this debate?
Wow. I think it's a hybrid. I think AI will make you, as you've seen, Khan, 100 times more efficient. I think there are less than 40 radiologists in Uganda. So I see this as Archimedes saw the lever. I see this as a lever arm. There's no replacement, guys. We still need you for a while. Sorry, but we are giving you a tool and we're giving you a lever so we can triage, so you can work on the patients that need it, so you can help people globally, so you can help 1,000 people at once instead of once. So Steve Jobs liked saying the computer was the bicycle for the mind. I think AI is the lever arm for the radiologists.
Yeah, that's exactly how I feel about it too. Two questions from anonymous attendees. One is that in your diagram where you're putting it all together, you show app marketplace in the ecosystem. Can you comment on how you see them playing a role in the future?
Oh, wow. Super important. And still a dream of mine at all of our companies. Nobody has a monopoly on the smart people in the world. And so at Butterfly, we can put a team on ejection fraction. We can put a team on aortic aneurysm. But there's 1,000 things you need to do. And so what you have to do is build tools. And so we had built tools to allow people to build AI apps for Butterfly IQ. And we'd given some of those tools to Google and Microsoft, and they had used them to allow anybody to diagnose childhood pneumonia. And that's fantastic because right now, and this is something we're going to change, 2,400 children die a day because of childhood pneumonias. These are insane numbers. And we can change that. But what we learned during COVID was all the work that Gates and Google did on diagnosing childhood pneumonia were immediately applicable to diagnosing COVID lung. And we immediately ran seminars on how to diagnose COVID lung, and we had software that could help you do it. So it's so important to have a community of developers for that long tail. And one day that long tail might come and be the fat part of the tail and save someone's life, as it did at Butterfly during COVID. So yeah, you need a community. You need to allow other people to develop. And my dream, not realized yet, is to have people develop things that then get FDA approved. And one of the reasons I love the veterinary applications, especially at Butterfly IQ, is because there are less regulations. I do expect some smart vets to develop some amazing applications and fill out the long tail of things you can do. So sure, we wrote an application to split the screen so you could do biplane imaging of needle guidance. Super important for Butterfly, super important for our customers. But there's a long tail of applications. And I think using veterinary as an area to develop them will allow us to figure out how to do it ultimately in healthcare, in human health.
I think probably 2 minutes left, so I'm going to jump to a last question. The question is, with all your success, all your work you've done, what is the single piece of advice you would give to the early entrepreneurs among the group here?
I think it's pretty easy. My dad taught me that if you do what you love, you never work a day in your life. And what I've learned is it's not just, as Steve Jobs says, the journey is the reward. The journey is the reward if you do it with people you love. And I have loved working with the team at Butterfly. I have loved and learned from the team at Hyperfine. And so make sure you love what you do and you bring together people And if you're in your position that you do hiring, hire people that you want to love to run to work, share an idea, and be wrong. I love being wrong, because if I'm wrong, it means I surrounded myself with the right people and I take full credit for it. But make sure when you put your team together and you're working on something you love with people that you want to run to work with, make sure you have a ground rule. Nobody can say an idea is dumb. They can only say they have a simpler idea, an idea that can be done with more velocity, speed with direction, or something that will scale better. They can't just say it's a dumb idea, because at big companies, you can get promoted and be right 60% of the time, which is a good batting average, by saying something won't work, because 60% of the time it won't work. And then they get promoted. And that's why often these big companies didn't make an ultrasound on a chip like we did at Butterfly IQ. So that's my advice. Love it. Work with people you love. And don't let anybody say something's a stupid idea.
Amazing. Thank you, Jonathan. Dr. Rothberg is always inspiring to the teams here. And, it's been my pleasure knowing you for the last 2 years and just seeing the amazing creativity you bring into the team. So that is awesome. I'm going to end this session. Thank you for joining us this morning. Up next at 11:10 a.m. Eastern Time are the Industry Connect sessions with IBM Watson Health, Konica, Minolta, Sectra, and Visage Imaging. See you at one of them, and have a great rest of SIM 21. Thank you, everybody, and thank you, Sim, for inviting us to give this keynote.
Thank you.